Let's look at electronic devices and see what exactly are we talking about here. What type of electronic devices does your practice use? And you may be surprised. You can see that we have big broad categories of servers, phones, tablets, and computers. Well, that includes all of your networked appliances. That means the Wi-Fi routers, the firewall appliances. If you contract with the cloud, that would be having the cloud basically part of your obligation to secure information as part of your practice, even though it's not on site. But what do you have that you can touch in your office? You have the servers. Then you have the kind of big, broad phones and tablets. These are all mobile devices. They include the watches, iPhones, iPads. We in the medical field, it's becoming much more common for physicians and medical assistants to review and schedule their patients right there on their iPhones. And what are the risks of carrying around that information and then transmitting that information over the cloud? We'll talk a little bit about that. Then there's computers. You've got your computers and you've got your laptops. And there's a whole category of ancillary devices that you might not even consider as being a repository of protected health information. And let me give you a quick example. Think about the scanners that you use, or the fax machines, or photocopiers, for example. To the extent modern photocopiers and fax machines and others take digital images of whatever it is you're intending to copy or send, those images are stored on a hard drive. And sure enough, unless you think about your photocopier as a little computer, if your photocopier goes off lease, all of your protected health information on the hard drive goes with it. True story. Several years ago, CBS went and got, in New York, I understand, went and got a photocopier. They'd just come off lease. They took it into their office. Somehow they got into the hard drive and found hundreds of thousands of medical records. It turned out that the photocopier had been used by a health system. And when it went off lease, nobody thought to look into the hard drive of the photocopier to see if it was necessary to scrub the hard drive. So next time you go to your your copier lessor, and you might want to say, listen, what happens to the hard drive when this thing comes off lease? Is there any way we can wipe it and make sure that we have something in our records to show that we did wipe it before we turn the photocopier back over?